right. Thank you so much, Miss Danielle, for the reminder to record, and welcome everybody to our class meeting, the first one of 2025. Um, I hope that y'all are feeling the same way as I am and just ready to jump into this year and make it awesome. Um, we are smack dab, well, we're like 2/3 of the way through Module 152. So we're rocking right on along. Hope you guys really enjoyed your holiday. Happy New Year. That's our first announcement. Happy New Year. Welcome back. We are so happy to be back with y'all. Of course, we enjoyed our break too, and I'm sure y'all did. It's always nice when you can take a breath, relax, spend some family time, and kind of regroup. Focus, refocus on your goals and what you're wanting to achieve this year. So just Happy New Year, guys. Happy holidays, all that good stuff. Next announcement, we're going to have another holiday coming up. No class on Monday, January the 20th. In observance of Martin Luther King Jr. Day. We're going to not have class. We will resume on that Tuesday, January the 21st, though. So it's just that day. So enjoy the 3-day weekend. Miss Danielle or Miss Jessica, any other announcements from pertaining to you guys' classes or anything I might have left out Unitech-wise?
The only thing I want to kind of just say, and I say this pretty much on every live, make sure that you are completing your daily assignments, labs, and exams as we get through the module, because this module is getting ready to close on the 22nd. It'll be here before we know it. So if you did not take the break for Christmas, the time to actually get caught up on assignments, and you're still working from behind, please make sure that you get with me to set forth a plan to make sure that you will complete all assignments within the module before this module ends. I want to make sure I say that to everybody. Please make sure that you are going back and complete those assignments if you've fallen behind.
Thank you, Miss Danielle. Excellent reminder. Yeah, guys, definitely. I hope you took advantage of the 2-week break and got caught up if you were behind. If you didn't, now is the time because, like she said, this module is going to end on, I believe, the 22nd, right after Martin Luther King holiday. And then we're going to roll right into 153. All right. So today we're going to just very short presentation. We're going to highlight some things in chapter 6 and 7, some important points we want to talk about, and then we're going to do a fun little activity, some trivia questions, kind of a 6 and 7 little review, and some practical coding practice. But it should be fun. It should be fun. A little contest. So the first thing I wanted to talk to you guys about today, and y'all read about in chapter 6, was pressure ulcers. And this is something that if you work with a doctor who sees a lot of elderly patients, a lot of bedridden patients or anything like that, this is something that you might see a lot of. Pressure ulcers develop when the circulation to an area is decreased by the application of pressure to that area. Patients restricted to bed or unable to change position often develop pressure ulcers. As the sores ulcerate, the deeper layers of tissue such as fascia, muscle, and bone may be affected. Pressure ulcers are graded and reported based on the depth of the ulcer and categorized in stages as illustrated in figure 6-3. And that's in your book. I think I have the page number down there. I do not. I think I have it on the next page. On what page number, but that is directly from your book, and you can see the figure shows the picture shows stage 1 and stage 2. And in stage 1 they call that
erythema.
Thank you. Excellent. Or redness of the skin, basically. And basically this happens a lot to patients, like they said, that can't move around a lot. Patients who are bedridden or confined to a wheelchair. And what it is, and it happens a lot on the tailbone, the hips, elbows, things like where they touch the bed or rub the bed consistently. That constant pressure on the skin will start to break it down. And it starts out in stage 1 as some redness, looks like some basic irritation on the skin. Okay, it's affecting that very top layer of the skin. And as the stages progress, it gets deeper. Okay, so stage 2, it's going through that top layer and it's starting to make a sore. It's starting to eat through that top layer of skin and get into the dermis, that second layer of like tissue. Okay, so that's when you're going to start to see bleeding. You're going to start to see sores that aren't going to heal correctly and things like that. That's why patients, a lot of patients who are bedridden have home health people or people that take care of them on an around-the-clock basis, because they have to be turned every 2 hours, or they start to form these sores. I've unfortunately had a good friend of mine who was paralyzed. She was a quadriplegic, and poor thing got bed sores like this before she ever got home. She had an accident that paralyzed her, and while she was in, the hospital and physical therapy, she ended up getting these sores that turned really severe before she ever even made it back home. And this happens a lot, like I said, with elderly people who don't get around as much anymore. All right, so stage 3 is the third picture here up at the top, and it says full thickness loss of skin up to but not through the fascia. So basically, it's all the way through those top 2 to 3 layers of tissue, and it's starting to get down to the muscle, okay? And when you hit stage 4, it's full thickness loss, and you basically down to the bone, okay? The infection just eats through the skin all the way down to the bone, and it's very painful and very uncomfortable, unfortunately. But yeah. Stages 1 through 4, they get worse as you go down, and by the time you're at stage 4, it's all the way through to the bone. Let's see. All right, we also talked about multiple coding in chapter 6, and that's where you have one code and it specifies that you have to code something else with it, so you're using more than one code in a scenario and stuff like that. And it says a use additional code preceding LOO, diseases of skin and subcutaneous tissue, directs the coder to identify the infectious agent, B95 through B97, in addition to the code in the category L00 to L08, making multiple coding necessary. So like you're saying, for this one, the diagnosis, and you see this off of page 151 in your textbook, the diagnosis is Staphylococcus arthritis of the right wrist joint, okay? So, in the index, it says arthritis, arthritic, acute, chronic, etc. All right, and then the tabular, M00 is going to be your category, and then it indents down from there until you get to the correct diagnosis that is specific to that wrist and that disease. All right, so, but it wants you to, because you have a skin or disease that was caused by something else, it wants you to code that cause, right? What infectious agent, B95 through 97, do you need to code in conjunction with the other code to make it all work, to give the insurance company all the information they need to have to pay this claim, okay? It says M00 reports direct infection from a known organism. A code from category M00 is reported first, followed by a bacterial agent, B95.6 through B95.7. Basically what we just talked about. And guys, 9 times out of 10, maybe even 10 times out of 10, if they require an additional code, the book is going to tell you. Your guidelines are going to tell you and direct you what you can code together, what you need to code together, what you have to, and what you can't. So always, go back to those guidelines when in doubt and just read those over. All right. Genitourinary. Can't ever say that word right.
Miss Brandy, I was just saying to myself, "Ooh, let me lay money. How's she gonna say it?"
Can't ever say it right, Miss Marsh.
I can't either.
Genitourinary. I think that's the closest to right I've ever said it. Genitourinary system. All right, so in chapter 14 of your ICD-10 manual, you're going to find your genitourinary system, which is N00 through N99. This chapter contains codes to report diagnosis of the male genitalia, female genitalia, breast, and urinary systems. One of the most common disorders reported for the codes from chapter 14 are kidney stones located in the index under the main term calculus. All right, and the reason I wanted to bring this up, kidney stone, because like they say, it's one of the things, especially if you end up working for a general practitioner or something like that, you may see kidney stones quite a bit. It's pretty common, okay? But your average Joe does not think kidney stones, calcium deposit, calculus, do they? Has any of y'all ever heard the word calculus in a relation to medical terms before today? Those of y'all that don't have experience with medical?
I have heard of calculus because I do get kidney stones, but it's actually not calcium stones, it's uric acid stones. So
Okay.
I was gonna ask you, is there different codings other than for calcium stone, which is calculus?
I don't think so. I think they all quantify under calculus. I think, though, I'm not an expert on that by any means.
Okay.
But you could always jump in there and go to that main category
Mm-hmm.
and go ahead and peruse under there, and it'll tell you.
Okay.
Excellent question, though, Clarissa. Thank you. All right. So, and again, as usual, I have a lovely little excerpt from your textbook there from page 155 that shows you how they coded flank pain with dysuria and emesis with 3 renal calculi visible on the x-ray. All right, but it's not always going to say calculi. That's an easier way to get to it, but very rarely when they talk about kidney stones do they break it down like that. So it's helpful to know some of those odd terminologies, right?
It just means more than one stone. Calculi.
I think
Mm-hmm.
I would think calculus would
Calculus
be,
is one.
maybe calculus. I don't know. I don't know.
Miss Brandy, I looked it up. There's types of kidney and urethral stones. There's calcium stones, uric acid stones, struvite stones,
Yep, struvite. Yep.
and cysteine stones, but they're all under the kidney stone topic heading.
Oh, okay, cool.
You-
Thank you.
I was curious. I had to look.
I was curious myself.
I was gonna look into it after class, but you just saved me some time. Y'all, we love when y'all ask questions because it's most of the time it's a learning experience for us too. If there's something that y'all ask us that we don't know, 10 times out of 10 we're gonna go back and look it up and figure out what you're talking about after the fact. So thank y'all for coming up with the great questions, and please don't stop. We need to know too. All right, so in chapter 7, you're going to hit on the maternity codes and pregnancy codes and things like that. Pregnancy, childbirth, and the puerperium period. Things to keep in mind for this chapter. Coding is complex in that there is extensive use of multiple coding in ICD-10. And this is for chapter 15 we're talking about. There are instructions throughout this chapter that must be read thoroughly. So, when you start talking about pregnancy and childbirth and things like that, you're going to start getting into there's trimesters, right? It breaks down into 3. And a lot of times it wants you to be really specific about what trimester they're in, or even more specific than trimester, they want what week of gestation that the patient is in. So it gets complex when you have to start y'all hear me talk about indenting down to get specific. It really gets specific in chapter 15. All right, so any condition that occurs during pregnancy, childbirth, or the puerperium is considered to be a complication unless the attending physician specifically documents that it neither affects the pregnancy nor is affected by the pregnancy. So what they're saying is if someone is already pregnant, anything that pops up during that time span is considered a complication of the pregnancy unless specifically said otherwise, okay? Like, I was diabetic before I was pregnant. So that's not, he made specific notes saying she had this before. This is not caused by, it wasn't gestational diabetes. It was regular type 2. Y'all see the difference there? Something that's caused by the pregnancy or something that they had before or just happened to come about while they were pregnant. All right, and the last one, I always have to move my little thing to see the last thing. Chapter 15 codes are never used on the newborn's record because they're only used on the mother's record. Some coders get confused about using this set of codes on the child and the newborn. They have their own. They have their own. We do not use, these codes are specifically for the mother, primary patient. The fetus or the child, until it is born, we're not coding, we're not going to be coding for them yet. So just bear that in mind in chapter 15 when you have scenarios that mention the child or the newborn or something like that. Let's see. All right, so a few minutes ago I mentioned about how they get really specific about trimesters and weeks of pregnancy. The majority of codes in chapter 15 have a final character indicating the trimester of pregnancy. The time frames for the trimesters are indicated at the beginning of the chapter. If trimester is not a component of a code, it is because the condition always occurs in one specific trimester, or the concept of trimester of pregnancy is not applicable. Certain codes have characters for only certain trimesters because the condition does not occur in all trimesters, but it may occur in more than just one. All right, does that make sense to everybody? So most of them have their own specific coding for each trimester unless they only are specific to one certain trimester or another, okay? But again, all this information, guys, is in the guidelines and in the instructions around the codes. Just make sure you're reading above, reading below, and including whatever information they need you to include.
Could I ask, like, what would you do, like, as an example of this? Like,
Sure.
maybe could you explain preeclampsia, like how that would work in this scenario?
From what I understand, preeclampsia can occur in any trimester.
Okay.
So I would imagine it would, I don't know off the top of my head, Clarissa, but I would imagine that it has a code and then it wants you to specify which trimester it's in. And there may be even one to specify when it began. If it began during the pregnancy, there may be a code to specify that, or it may indent down even further to indicate that.
I'm
Yeah.
sorry, my questions are
No, you're good. You're good.
And it may have some guideline information specific to preeclampsia that gives you just a little bit more information as to how you're going to apply that code and kind of when you can apply it, where it needs to go, or if another code goes along with it. So when you're looking at something specific as like for preeclampsia, and it can be so broad depending on like where it happened in the pregnancy, make sure that you're reviewing your guidelines, looking over your guidelines so that you can be specific to how it needs to be coded out.
Okay, thank you.
Excellent. Thank you, Ms. Danielle. All right. All right. So that is our short presentation for today. Now we're going to move on. Give me 1 second to click on it, and then I will share it with you guys. Our Kahoot activity for today that I've got set up for you guys. Share. All right, can you guys see it?
Yes, ma'am.
Game pin 7572013, or you can scan the QR code with your phone. All right, we got Shay in there.
Almost there.
Miss Brandy, do
Fox
you
is
want
in there.
instructors to participate or no? Do you want us to participate?
Y'all do your thing. If y'all want to, hop in there.
Okay.
Okay, I'm gonna participate because I have to redeem myself from the Christmas game we had since I lost.
There you go. Yes.
There's no way that I'm not gonna play.
No, that's right. All right.
But I get to try it.
Here we go.
All I'm saying is y'all missed a good Christmas game.
Yeah.
Whitney.
I wish I could have been there. I don't know what happened.
Is that everybody? Or are we still waiting on? Looks like still might be waiting on one. All right. We ready to start, guys?
I think that's
I
everybody.
think everybody.
Go ahead, because I can't jump on, so go ahead.
Okay. I think you were the one I was missing. It's Elizabeth, right?
Yes, yes.
Okay. All right, so here we go, guys. So this is just a couple of trivia questions on some of the information we just went over, and then a couple of practical coding scenarios for us to go over together. So this is number one. What's the first step in accurate coding for your ICD-10? You got 20 seconds for these first 4 trivia questions. All right, I've got 5 answers, 6 answers, 7 answers. All right. So, who said identify the keywords as the correct answer? Excellent. Good job. Identify the keyword is always your first one because you got to know where to start, right? All right. Next.
I don't think it want me to play again because now my phone frozen.
It wouldn't let me pick the answer. It was
Me
like, yeah.
either.
Nope.
Huh,
not
maybe
letting
it
you
knows
pick.
y'all are instructors and is booting
And
you out.
why the instructors always got an excuse.
That's what I was gonna say. Excuses, excuses, because guess what? I'm doing just fine over here.
All right. Shay got that in first. So there y'all go. And then Andrea, Taylor, Whitney, Miss Marsha. Good job, y'all. All right. So number 2. If it isn't what, it didn't happen. Talked about, put on Facebook, documented, or searchable on Google. Wow. I must have said this enough in class. Very good, y'all. Very good. It is not counting Danielle and Miss Jessica, it looks like.
Brandy, because we're at the bottom. That's why, Brandy.
I got it right. It's not
Or
even
maybe it just
showing us-
shows the top 5.
Yes.
Yeah, I think
Maybe just
so.
showing the top 5.
Maybe so.
I'm gonna need y'all to get on the board. Which stage of pressure ulcer includes full thickness loss, including fascia? Remember, there's 4. 1, 2, 3, and 4. All right, so we had a couple answers for stage 3 and a couple with stage 4, one for stage 2. All right, if you said stage 4, you were correct.
I was hollering stage 4, but of course I'm not on there, so I was like, oh, 4, 4, 4.
You are exactly right. You're exactly right. Remember, stage 4 is the worst,
Yes.
the worst level, and it's all the way through. All the way through. Very good, you guys.
Maybe I should just stay unmuted and give my answers
No, don't give everybody else the answers too.
after they answer, when time's up.
All right, condition occurring during pregnancy is considered a or an what, unless the doctor states not affected by the pregnancy. Interoperative, postpartum, complication, or bad omen. All right, y'all got like resounding correctness on that one.
Yeah.
Certification. Very, very good. All right, so I think the next four are coding scenarios. So go ahead and grab either your manual if you have one, or pull up your ICD website on the side, and let's see what we can do. I gave us more time, like 2 minutes per question on these, so we have time to look them up. Oh, Miss Jessica's on the board. Taylor's on fire. Clarissa's coming up too. Good job, ladies. Good job. All right, so using ICD-10, code the following. Rheumatoid arthritis. And I give you four possible choices here. 4 possible choices. 2 minutes to look it up. Let's see what we can figure out. Do 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 do. Okay, I'll stop. All right, y'all are almost done. 8 answers. All right, I'm gonna go ahead and skip along.
It's yep.
Almost everybody got it right. M06.9 is your correct answer on that one. Is your correct answer. So with that one, guys, you're going to start, it's pretty basic. You're going to start with arthritis. It's pretty straightforward. Start with arthritis and then figure out what kind it is. Right. Oh, Clarissa's in that top
Well,
spot.
not by much.
The top spot. All right. Dermatitis due to poison ivy. Dermatitis due to poison ivy. Can y'all hear the little game music?
Yes.
Awesome.
I don't need that. That's in CCT.
Yeah. Miss Marcia. All right, so we got 7 answers in. All right, good
Thank
job,
you, sir.
guys. L2 3.7. And y'all noticed in there it did not say poison ivy specifically. It said plant, right? So some stuff they specify, some stuff they leave kind of general. Clarissa's on fire. She's on fire. Highest answer streak of 5 in a row. Get it, girl. Get
I love coding.
it. Initial encounter for infected breast implants. That does not sound pleasant. I didn't pick the music, but I kind of like it. I feel like I should be riding in my car.
It's a little ominous.
It kind of is. back it up. All right, 6 answers. Almost there. Still got a minute left. No rushing. I have a small person that's trying to get my attention. All right. Oh, got all of our answers in. T85.79XA is correct. Very, very good. All of y'all got it correct. Every single person. Good job, y'all. Oh,
Oh,
oh.
yeah, took too
They
much.
were a little bit faster on that one.
Good job, Dre.
On that one, Clarissa. You got it. Though.
Good
You
job.
got it right. Good job, Miss Jessica, with 6 in a row. All right, guys. Last one. Let's see who's going to bring it home. False labor of 38-week pregnancy undelivered. Oh, I forgot to change the time on this one. Shoot. Do y'all know if I can redo a question?
I don't think you can reset it once you've already created it.
I forgot to change the time on the last one.
It was 047.1.
Yes, it was. Yes, it was. Dang it. I'm sorry, guys.
Yay, Clarissa! Yay,
Yes.
Miss Jessica!
You got number 1.
Yay.
Andrea!
Yeah.
Thanks, yo.
Good job, Andrea. Good job, Miss Jessica. And good job, Clarissa, girl.
Jay and Tay were right up there
Right
too.
there.
Thank you.
Very good, ladies. Very good.
Good job, y'all.
All right, so that was fun.
That was definitely fun.
I will try to make sure next time that I have all the times correct on all the questions. But great job, you guys. Great job, you guys. Andrea, I'm going to text you in a little bit. I'm going to give you a prize for winning. I can't guarantee prizes for everybody, but she's my student, so I can give her a prize if I want to.
Thank you very much.
You're very welcome.
I want a prize.
You didn't even place.
Oh well.
You
no.
get some.
Can I make a quick announcement, Miss Brandy? Can I say something real
Absolutely.
quick? Hi, everybody. In case you guys don't remember me or you haven't met me, my name is Miss Marcia. I'm the Director of Education. And please excuse the fact that I look like I'm sitting in a bedroom. I am. It is so cold. I have to sit under the electric blanket today because my office will not warm up. But I just want to tell you guys how amazingly proud I am that all of you came back to school after the holidays like gangbusters. I mean, we have been, did you guys kind of pay attention to the attendance challenge that we did up until then and all of that? Everybody did so well. And I just wanted to say, that when I would go to the Lafayette campus or when we would have meetings with all the other campuses, even though I'm online and I don't have an actual campus, like this is our campus Zoom, I actually pulled up everything that you guys were doing, what your stars were, who was where, so the whole company knew about how well you guys were doing with your attendance. And I just wanted to make sure that you understand that just because we're online, you're seen. Believe me, I'm constantly bragging. Like tomorrow, I'll be telling everybody at Lafayette, I was on Kahoot yesterday with these students, and they did so well. So we do talk about you. You are seen, and I just want to say Thank you for always putting your best foot forward, and I can't wait to meet you at graduation. So just keep up the good work, everybody.
Thank you, Miss Marcia. Yeah, you guys, to piggyback on what she said, we really appreciate you guys showing up today and this week. And we know it's a challenge sometimes. You get out of routine. I am the worst about getting out of my routine. I'm like an old lady like that. I gotta stay in my routine or I lose track of everything. So just we know it's a challenge sometimes. So just thank you for putting in that effort and making school a priority. We really appreciate you guys, sharing your time with us. Yeah.
Definitely.
All right. So before we let go today, are there any other questions, concerns, anything y'all have for us or need from us today?
No, I don't think so.
Miss Danielle, I need to talk to you after class.
Okay.
All righty. Well, if you guys do not have anything else for us today, that's all we've got for you. Have a great rest of your afternoon. Do your best to stay warm because it is so cold. And enjoy the weekend, and we will talk to you guys next week.
Alrighty.
Bye,
Try not to make these
everybody.
stories
Be
long.
safe.
Bye.
Bye, guys.
Bye.